and my greetings to everyone. I'm Dr. Vinod and I'm pursuing post-MD PhD here in the Department of Physiology, KGMU. And today I would like to report on my MD research topic, which is the comparison of heart rate variability parameters between women with polycystic ovarian disease and apparently healthy women. Let's talk a bit about what is PCOS. So in 1935, Steen and Leventhal, he diagnosed this disease as a syndrome manifested as oligomenorrhea, hirsutism, obesity, and enlarged polycystic ovaries. So it's a multifactorial and polygenic disease. And if we talk about the etiology, then it have a different pathogenesis, which is the first one is there is abnormality in hypothalamic pituitary ovarian axis. Secondly, there is anovulation, obesity, and as well as the insulin resistance. Now, this PCOS, it has been shown to be associated with the increased insulin risk, type 2 insulin diabetes mellitus, as well as the cardiovascular diseases. So the PCOS patient, they show common features like increase in insulin resistance as well as the adiposity, which has been known to correlate with the autonomic dysfunction. I strictly speak with the cardiac autonomic dysfunction. Now, what I did with these patients, I did the HRV analysis. HRV is the abbreviation for heart rate variability. A quick question: how many of already aware of this HRV? Only one. So I need to explain it. So let me define it first. What it is? It is the fluctuations and variation which are present between the RR intervals, right? So why I chose this analysis? Because it gives us a combined the sympathetic as well as the parasympathetic measures. So how it analyzes it, how it interprets the result according to the differentiation of the frequency. Because different frequencies are produced because of the different variability which are occurring in our body, like short-term variability, which is produced because of the respiratory sinus arrhythmia, and other long-term variability which is produced because of various oscillations from the baroreceptor loop and as well as the thermoregulation. So under the interpretation of HRV, the high frequency component, it dominantly it reflects the parasympathetic activity, and the low frequency component, it is associated with the dominantly by the sympathetic activity. So in this way, it gives us a analysis regarding to the autonomic system. And the most important component is the LF and HF, which tells us about the sympathovagal balance. And the normal value for the sympathovagal balance is 0.5 to 1.5. This is the normal value. So the aim of my study is to compare the time domain as well as the frequency domain analysis of heart rate variability parameters of PCOS as well as the control groups, which were the apparently healthy female. And moreover, under my objective, I also studied the impact of blood pressure and the other cardiometabolic factors like BMI in case as well as control group. So it was a case and control study, as I already told you. The total sample size was 60, 30 cases and 30 controls. Under inclusion criteria, I included women of reproductive age group 20 to 40 years diagnosed with PCOS according to the Rotterdam criteria. As you can show this figure, these are it includes 3 criteria. If any 2 come positive, we think that this patient has the PCOS. Anovulation, hyperandrogenesis, as well as the polycystic ovaries in USG findings. So actually I did USG findings normal in my cases as well as controls, because I need to compare those findings also. Now the control group consisted of the women with regular menstrual cycles without clinical and biochemical sign of PCOS. Basically they were all the attendant of the patient. All these 60 patients are drug naive. They were not on any medication. Now this is the very important part actually, the exclusion criteria, because HRV itself a very sensitive indicator. So they excluded the pregnant and postmenopausal women, those with diabetes mellitus, all the group of subjects who already have some established disease. So I need to exclude them. dyslipidemia as well as the hypertension, if there is any history of any kind of substance abuse, all the CNS stimulants like tea, coffee, they will be excluded. All the drugs which affect the anus as well as the thyroid and all. These are the laboratory tests for PCOS: serum testosterone, LH, FHS, which is increased with these women, prolactin, PSH, lipid profile, and the fasting blood glucose. BMI and anthropometric measurements were taken. The serum insulin and blood glucose were estimated by using the fasting sample of blood. Then this HRV analysis was done by using the AD instruments. I basically use this version, HRV 2.0, which is the latest version. And this lab is, rarely you find this lab, only in our department, autonomic nervous system lab is present. This is a special facility in our lab. I completed my research work in the physiology department. Now these are my results. In PCOS patient, they have significantly increased body weight, BMI, waist and hip ratio, systolic blood pressure as well as the diastolic blood pressure. The mean serum insulin was also raised with the cases, and the mean plasma glucose was also raised in PCOS group. If you talk about the heart rate variability parameters, if under frequency domain analysis, the total power, which reflects the total reflectivity, the total variation. So if it is more, it means that the autonomic nervous system is well functioning and you are highly adaptable for the external variation in the atmosphere, because your heart should be variable with the external changes in the atmosphere like temperature, stress. So, so these findings, the parasympathetic findings, which stick to the HF percentage, HF new values, they are found highly in the controls when we compare with the cases. And the sympathetic reflection, it was more with the patient, like LF percentage, LF2, and as well as the sympathovagal ratio, it was higher with the control cases. Now, in time domain analysis is just, it's a statistics which this software does, and it tells us the parasympathetic variation, like this RMSD. If you want to know the full form of these, this is the root mean square variation of the RR interval. PR50 is it just differentiate how 50 milliseconds se kitne differ hain RR intervals, and SDVR is the average of standard deviation of the RR intervals. And they were higher in the control group, which is good. Means there is a parasympathetic dominance. This is my tabulated form of result. The age is approximately same, 28 cases, and interval is 27. The body weight higher with the cases, and BMI, systolic blood pressure, and diastolic blood pressure, it was more with the cases. And now this is the comparison of frequency domain HRV parameters between the cases and controls. The total power, it is more with controls, 3, 5, 3, 4, and the LF percentage, it is higher with the cases, and the new 66, it is also higher. The HF variables, they are higher in control group, and the LF by HF ratio, it is significantly higher in cases. It is 2.34, and in case of controls, it is 0.62. So in controls, it's come under the normal range, 0.5 to 1.5. So I'll conclude my study. The insulin resistance had a definitive impact on heart rate variability, though cardiometabolic factors have their own incidental effect on the heart rate variability. In cases, sympathetic, I found a sympathetic overactivity means there is a disturbance in the autonomic nervous system, and PCOS females had a reduced or blunted HRV and altered autonomic function. So this study, the outcome of the study is that if we do the analysis in these patients, so we can early diagnose the autonomic dysfunction in these patients. Thank you so much for your attention.
Okay, so no one is asking, so it's our duty to ask. So Dr. Vinod, so how do you think that PCOS is related with the change in body weight?
Body weight?
Yes, because you are showing in comparison to
I will show you the first slide that it is related to the adiposity. Yeah. But the first hit in this pathogen is the weight hit. When the BMI increased, then there all other pathogens start. inflammation in our body. Once the inflammation increase, the autonomic levels start.
Okay. Another query is that when you measure the HRV, is it a fixed time per day or
Yes, it
repeated?
is a fixed time because we do have HRV analysis. HRV will be raised during the time because of parasympathetic dominance, and during the daytime there is sympathetic dominance. So I fix one time, 11 a.m. in the morning.
Related to this question, do you have the profile of their work, all the patients' work profile? I mean, if they were shift workers or...
They were not. Most of the females, they were housekeepers.
most of them.
Yes.
Because as
They
I
were,
understand-
none of them were working, they were all.
As I understand, there is a critical relation between melatonin and PCOS. So I think there's a melatonin also used for PCOS treatment.
Melatonin, no, it's not in that direction.
What is the
For the
incidence? What is the incidence of hypnotism between
So,
percentages?
so it is 5 to 10, slight between 5 to 10.
Pretty high, right?
Yes, sir, very high. That's why sample size was less. Yes, prevalence was 5%.
Actually, I want to add one comment on that. The story of PCOS is not related to a gynae issue. It's a story of metabolic syndrome. And now, nowadays,
PCOS irreversible. This
From animal model studies, I know people are
Yeah,
using
right,
it as
right.
vitamin D to treat it and then comparing it with the metformin treatment.
would you like to share what you found there?
Yeah, I will say.
and one more thing, Dr. Ritu permit, vitamin